Yes?
This might be a dumb question, but
No dumb questions.
Severe scoliotic patients, like when you get them off the table, how do you straighten out the spine? Like a contraction, going through their,
Well, the muscle contraction, that's the easy part. That's why we have great anesthesiologists to help with a little bit of that. But a lot of it changes with position. So when we do CAT scans that are done lying down or x-rays done lying down, they look very different from patients who have standing x-rays. So we already know there's a positional change. The other areas where we get correction depends on whether the spine is flexible or whether it's rigid. And rigid can be sort of stiff or can be totally fused. Now, if it's totally fused, then there's no flexibility. So we have to create flexibility, and we do that by loosening up the joints or cutting the bone entirely and resetting it. And so it really just depends. In many cases where there's some flexibility and it's just a muscular problem, positioning, anesthetic, those things help. And as some of those slides showed, some of the instrumentation allows us to get corrections in a fairly gentle manner, just with manipulating the instrumentation and kind of moving the rod around. In other cases that are more stiff, then we've got to work a little harder. Yeah. Good. Any other questions? Okay, very good. Well, thank you very much. Thanks for your attention. Oh, thank you.